Lipids in health, cardiovascular disease. We're going to define cardiovascular disease and explain the process of atherosclerosis. We're going to list at least 3 modifiable risk factors and 3 non-modifiable risk factors for atherosclerosis. We're going to distinguish between high-density lipoprotein cholesterol and low-density lipoprotein cholesterol. We're going to discuss dietary and other lifestyle actions that can actually reduce your risk of atherosclerosis. So, cardiovascular disease is a group of medical conditions that affect the functioning of the heart and the blood vessels. So you've got this big umbrella that we call cardiovascular disease. Under that, you've got chronic high blood pressure, heart disease, coronary artery disease, peripheral artery disease, carotid artery disease, stroke. So coronary artery disease, CAD, affects the arteries that are going to supply our heart, often leading to things like heart attacks. It's often called heart disease. So whenever we mention heart disease later, it's going to be coronary artery disease we're talking about. Carotid artery disease. Our carotid arteries are the arteries that go along our neck to supply our brain with oxygen. Abnormal function of the carotid arteries in our neck that supply the brain are carotid artery disease. Peripheral artery disease. Your peripheral vision is the sides. So peripheral artery disease are going to be affecting the arteries of our limbs and our pelvic region. So not our head anymore, kind of out from there. A stroke is when blood flow to the brain is either stopped or it's disrupted. And hypertension is going to be chronic high blood pressure. So I always think of tension and I think of blood pressure. The problem with chronic high blood pressure is that it can damage arteries that supply organs, especially the heart, the kidney, and the brain. These are all, of course, essential organs. So when you're damaging the arteries, you're interrupting the blood supply to these organs. So, from atherosclerosis to cardiovascular disease. Atherosclerosis. Athero means lipid. Lipid containing, sclerosis means hardening. It's a long-term disease process in which plaques build up inside arteries and result in cardiovascular disease. Plaques are these hardened areas in the artery that can get thicker and thicker and make the hole or the lumen of our arteries smaller and smaller. It's initiated by excess cholesterol or glucose in the bloodstream. This is why people that are diabetic can have this issue. Compounds from cigarette smoke or certain bacteria can actually complicate or make this issue worse. It leads to the formation of an arterial plaque, which is a lipid-filled deposit that narrows the artery. And because of this narrowing of the artery, of course, it interferes with circulation. The plaque may result in the formation of what we call a thrombosis, which is basically a fixed bunch of blood clots that remain in place and disrupt blood flow. So looking at this, we've got healthy artery up here. Here is when the lining of the artery becomes irritated, okay? So certain cells in the arterial wall start to deposit cholesterol and other substances under the lining to repair the damage. This is what starts our arterial plaque. Now the plaque narrows and roughens the normally smooth surface of the arterial lining, which slows blood flow through the area, making clots more likely to form. Think about a water pipe. If the water pipe has all kinds of crud along the surface, the water is not going to flow nicely through it. It's going to have to get over all of this gunk that's on the side of the pipes. As this starts to get thicker, that's basically what we're doing, except we're doing it inside an artery. When you look at number 4 and how narrow this has become, if a clot lodges on the plaque and becomes wedged in the lumen, in the hole of the artery, the blood flow through the artery can be blocked completely. This is where we have blood clots that are an issue, because literally this clot is completely blocking off flow, which means the tissues down past this that need that blood are not getting it anymore. Okay, so a thrombosis, or part of a plaque that breaks free and travels through the bloodstream. So I've got a thrombosis here. When it breaks off, it becomes an embolus. Okay? This embolus can literally float through the bloodstream, find a narrowed artery, and stick in it like a cork. Okay? That means that it can completely block blood flow to the tissues. When we talk about heart attacks or myocardial infarctions, that's when blood flow has been blocked from heart muscle. And when that happens, the muscle starts to die. A stroke is what happens when blood flow is stopped to the brain. Again, an embolus getting into any of the arteries that are feeding your brain tissue, and it blocks blood flow. When gangrene occurs, that can happen in a limb. When you've got a blood clot in your leg or your arm or whatever, that can actually, again, block the blood flow, meaning that your tissue starts to die, meaning infection can set in and you get gangrene. So, atherosclerosis in the carotid arteries. So like I said, our carotid arteries are the ones that come up and feed our brain. So with that in mind, if I end up with a clot flowing through these toward my brain, and again, it becomes a cork and it blocks blood flow, I'm going to end up with brain death or tissue death of my brain, which is going to be a stroke. Atherosclerosis also causes affected arteries to thicken and lose flexibility. So instead of having this kind of flexible artery that can stretch and accommodate for different pressures, you've kind of solidified the wall of that artery, and it isn't as flexible as it used to be. This contributes to the development of hypertension, abnormally high blood pressure. That is, again, a major risk factor for heart disease as well as stroke, because you're pushing. Blood pressure is when blood pushes on the walls of an artery. So if you're pushing and it's not moving, eventually it can actually tear or burst. And that can be an issue, of course. The heart actually, in the case of hardened arteries, has to work harder to circulate the blood through the abnormally stiff arteries, because the arteries aren't accommodating the differences in pressure. It actually has to push harder to get it through these hardened, non-flexible arteries. Because of the damage to the arteries, there's also an increased risk of internal bleeding issues. Even sudden death can happen depending on where that rupture happens, where the artery basically tears because the pressure is too high behind the blood flow. So, lipoproteins and atherosclerosis. Lipoproteins, lipid proteins, it's a combination of the two. These are things that transport cholesterol and triglycerides in the bloodstream. Because of this, they play a major role in the development of atherosclerosis, because remember, we're depositing these things inside of this inflamed area in our artery. There are 4 major types of lipoproteins: chylomicrons, very low density lipoproteins, high density lipoproteins, and low density lipoproteins. They carry different proportions of lipids and protein. Protein content contributes to the density of the lipoprotein. So a chylomicron, if you look here, I've got protein in yellow, phospholipid in kind of an orange, cholesterol in blue, and triglycerides in green. A chylomicron is primarily lipid. The protein is only 1 to 2% of the whole mass of a chylomicron. So, push comes to shove, this is a lot of fat. My low density lipoprotein, I've got about 25% of a protein and the rest is lipid. Very low density lipoprotein, I've only got 5 to 10% protein and the rest is lipid, whether phospholipid, cholesterol, triglycerides. Now my high density lipoprotein, 45 to 50% of this molecule is actually protein. The rest of it, whether it's 50 or 55%, is going to be my fat content. So their makeup is very different. Excuse me. The chylomicron carries more lipids and very little protein compared to everybody else in our group. High-density lipoproteins, HDL, is considered our good cholesterol. The reason that we say that is because it is transporting cholesterol away from the tissues in our body toward the liver, where it can actually be eliminated. The reason that this is so important is because this type of lipoprotein being transported does not contribute to plaque formation. The only exception is if it becomes oxidized HDL cholesterol. That may be harmful. But if we're just talking about high-density lipoproteins, they're actually transporting the lipids to the liver for elimination instead of trying to deposit them in the body. I'm taking them to go away. Low-density lipoproteins are what most people call the bad cholesterol, okay? This is, instead of going to the liver for elimination, carrying cholesterol to the tissues. These are the ones that will contribute to plaque formation, especially the small, dense form of the low-density lipoprotein and the oxidized low-density lipoproteins. Very low density lipoproteins, or VLDL, carries much of the triglycerides in the bloodstream, and high levels, again, may contribute to atherosclerosis. So our HDL carries the cholesterol to the liver. So I'm picking it up and carrying it to the liver to basically get it out of the body. My LDL, though, I'm bringing it back out to the body and depositing it in the body. And like I said, the LDL can also contribute to the plaque formation by dropping off my cholesterol in these plaques. Now, free radicals can damage cholesterol, causing it to become oxidized. So a free radical is a short-lived atom with extra electrons in its outer shell. It's an unstable atom, and it can kind of act almost like a bouncing bullet and damage molecules inside your body. This is why we try to consume antioxidants, because that kind of acts like Kevlar and absorbs these oxidized electrons, and it doesn't damage us. Instead, it sticks with the antioxidant. So, the risk factors associated with atherosclerosis, as defined by the National Heart, Lung, and Blood Institute. Things that are non-modifiable. I can't do anything about this. If I have a family history of cardiovascular disease, it might be in my genetics, and because it's in my genetics, I can do all the right things, but I might still get it. In addition to that, as you get older, the chances of atherosclerosis go up. Again, it's not something you can change. You're gonna age. Things that are modifiable. You can change an unhealthy diet. You can change your blood pressure, even if it's through medication. If you've got diabetes or insulin resistance, that's something that if you lose weight and eat healthy, hopefully you can get away from. Elevated blood cholesterol, especially the low-density lipoprotein cholesterol. Again, this is something you can help with your diet, and if you have to, you can get on medication. Excess body fat, you can lose weight. Physical inactivity, you can become physically active. Tobacco use and exposure to tobacco smoke. Remember those free radicals I was talking about that can damage the cholesterol and cause it to form plaques? Those free radicals, some of them anyway, come from tobacco products when you use them. So again, this is something that you can stop doing and reduce that risk. Advancing age increases the risk of atherosclerosis in males after the age of 45, and females after the age of 55. If there is family history for cardiovascular disease, the risk increases if a brother or sister is diagnosed before the age of 55 years old or 65, respectively. Homocysteine. It is an amino acid that may play a role in the development of atherosclerosis, even though it is not a human amino acid. Some medical experts think that elevated blood homocysteine levels may actually be a marker that indicates the person has cardiovascular disease. Some people actually have a mutation in their genetics that causes it to build up in the blood. So again, this is non-modifiable. It's not something that I can change. I can't change my genetics. Again, modifiable. Unhealthy diet, hypertension, insulin resistance, and diabetes. Physical activity, healthy diets, healthy sleep patterns, stopping smoking, managing your blood sugar, controlling your cholesterol, managing your blood pressure, managing your weight. All of these things you have the ability to change. But you also have to remember that atherosclerosis is going to be a very complex disease. It isn't just one thing that causes it. It's a whole bunch of things that have to kind of come together to cause this to happen. So it's a process. It isn't just you do this one thing and you get it. So ultimately, doing all of these things, again, if you are genetically predisposed, it's not necessarily going to help. So yeah, just keep that in mind. Assessing the risk of atherosclerosis. Scientific evidence suggests forestalling cardiovascular disease and living a longer, more satisfying life by reducing or eliminating those modifiable risk factors for atherosclerosis. Medical testing. A doctor can check your blood pressure and blood flow in your carotid arteries to check for blockages. Blood tests to check for your lipoprotein profile. Basically, we're looking at our HDL, our cholesterol, our LDL, our triglyceride levels. HDL and LDL levels are going to be critical indicators. If you have high HDL and low LDL, that's probably going to be a good thing. But if you have really, really high LDL and low HDL, that's not. Healthy ratio is going to be about 3.5 to 1 total cholesterol to your HDL. Someday we may be able to identify genes involved in atherosclerosis, but until then, it's wise to get regular checkups to basically try and make sure that you're in good standing with all of the levels of everything. C-reactive protein. Chronic inflammation is involved in the development of cardiovascular disease. The liver produces high-sensitivity C-reactive protein, HSCRP, in response to some types of inflammation. High levels of this particular HSCRP basically equals high risk of cardiovascular disease. It's kind of similar to homocysteine in that way. You might want to consider having both levels checked. Coronary calcium is another issue. So cigarette smoking actually causes significant coronary calcium. These are going to be calcium deposits in the arteries of your heart. Now remember, your heart has to get fresh blood supply so that the muscles keep working. So with that in mind, if you are a chronic smoker, you're going to have significant coronary calcium. You can do a computed tomography scan or CT scan that can detect the coronary calcium deposits, but it is exposure to ionizing radiation. So unless there is really high probability that this is an issue, it probably won't be done. So again, we're talking about the arteries that feed the heart and it causing blockages in those arteries. C-reactive protein, again, when you've got infections, obesity, atherosclerosis, type 2 diabetes, heart disease, allergic reactions, sepsis, which is an infection in the blood that is still growing, and cancer. That all of these things can cause increases in the C-reactive protein. Epidemiological studies examine the effects of dietary lipids on blood lipids and cardiovascular disease risk. General effects of dietary fat and cholesterol on blood lipids. Saturated fat increases total blood cholesterol by increasing LDL and HDL. Trans fats increase total blood cholesterol. They increase LDL, but actually lower our HDL. Our healthy cholesterol, they're lowering that. Monounsaturated fats lower LDL, but not HDL. So our healthy cholesterol actually stays high and our LDL goes lower. This is why I said earlier, you want something with monounsaturated fats. Polyunsaturated fats, including omega-3s, generally lower blood cholesterol and LDL. So, our fat intake recommendations: consume less than 10% of total calories from our saturated fats. Limit trans fatty acid intake as much as you possibly can. We mentioned that earlier, but just to reiterate that. What about omega-3 and omega-6 fats? Omega-3 fats, DHA and EPA. So usually we get this from fatty fish like salmon, canola oil, flaxseed, and walnuts. If you want more examples, you can look over here at this table. So what does it do? Why do we want it? 1, it reduces inflammation, it reduces blood clotting, and it reduces triglycerides. These are all benefits that actually may reduce the risk of heart disease as well as stroke. This is one of the reasons why we want omega-3. Omega-6 fats, the leolenic acid. Sources, we get it from vegetable oils, we get it from whole grains. Actions: it increases blood clotting and inflammation. Because we know that it does these things, its role in heart disease is kind of controversial. There's some that say it helps, there's some that say it doesn't. It's something we need to research more. The typical American diet will supply more omega-6 fatty acids than omega-3s. So again, you've got alternatives to kind of increase that over here. Should people avoid eggs? We mentioned this earlier that egg yolks have cholesterol. Eggs are a good source of protein and micronutrients, but they also contain saturated fat, and it's a concentrated source of cholesterol. In general, the cholesterol in food affects blood cholesterol levels in healthy people less than saturated fat does, though. The saturated fat is worse because we can use it and convert it into cholesterol. The American Heart Association recommends healthy people practice moderation when eating all foods, and that does include eggs. As well, you can, instead of eating whole eggs, you can eat egg whites, or you can eat egg substitutes. Food selection and preparation. Reduce your intake of fried foods. Ultimately, you're frying it in a whole bunch of fat. It's good not to do that. Purchase lean cuts of meat and trim any visible fat that you can see. Over here, you can see this has a lot of marbling, and I know people say with beef, marbling is the thing, it adds to the flavor. But if we're talking about your health, probably not. If you look at this cut of beef here, you can see that it's all on the outside. There's not a lot of marbling inside, which means you can cut this off and make it a bit healthier. Remove the skin from poultry before you eat it. Replace high saturated fat sandwich meats with nut butters. So instead of eating something like ham that has a lot of fat, maybe have a peanut butter sandwich. Replace some fatty foods with reduced fat or fat-free alternatives. So low-fat alternatives, things like that. Milk, for example, you can have, milk, or you can have low-fat milk or fat-free milk or 1% or 2%. And even if it's 1% or 2%, you still get fat, but it's not as much. Changing food selection and prep can reduce the amount of unhealthy fat in your diet. Purchase lean meats that have loin or round in the name. Try replacing some fatty foods with reduced fat-free alternatives. Because most nuts are rich in healthy unsaturated fats, replace foods that contain saturated fat with nuts. Pretzels, air-popped popcorn, and fruits and vegetables are low-fat and generally are more nutrient dense than chips, cookies, pastries. You can read this, but these are kind of tips for how to change your fat intake. Other dietary lifestyle modifications. Increase your soluble fiber intake. We talked about the fact that soluble fiber helps to kind of pull cholesterol with it, so you can do that. Reduce intake of refined starches and added sugars. Try to stick to things that have fiber in them. The other thing is, with refined starches and added sugars, I can convert those into fat. So if I am consuming a lot of that, I'm actually probably adding to what my body is doing. Limit your alcohol intake. Quit smoking. Again, we're talking about the free radicals that can damage cholesterol and cause plaque formation. Follow the DASH or Mediterranean diet. Lose excess body fat. Regularly perform moderate intensity physical activity. I'm not telling you to go run a 5K, walk around for 20 minutes. What if lifestyle changes don't work? Eating right, exercising. Remember, genetics could play a factor in this, which means that it may not have anything to do with your diet or your exercise habits or anything else. In that case, okay, you may have to go and start taking medications like statins. Those will help where the physical changes and the dietary changes maybe didn't.